Hey everyone, it's Dr. Hodges, and today I want to talk a little bit about one of the most burning questions that I get, or maybe one of the most frequently asked questions that I get from my patients, especially if they refer to me from a doctor and they have never really considered surgery before as a weight loss option. And certainly if you're a patient that has been referred to my clinic and it's either from your primary care doctor, so your family practice, OB-GYN, or especially if from ortho, you need back surgery or knee surgery, you've got to get that hip replaced. Or maybe you are having difficulties with fertility. I can speak to that, sister. And you need to make sure that your BMI or your weight is where it needs to be so you can undergo IVF or IUI. What do you do? And what do you do whenever you show up, whenever you're like, I've never really thought about surgery before? So I think that that's for people that are like on my 600-pound life. What do you do about that? So, I did a little Google search. I'm like, I'm always trying to find what is the best way to talk to my patients, because I always want to make people feel comfortable, especially giving them the best information and also being very sensitive to maybe their own bias towards surgery or to medicine or to weight loss or just all these awful feelings of insecurity and just everything wrapped up into a ball. Because in the end, I don't care how you do it. I just want to make sure you can lose some weight, because in the end, I want you to get that new hip. I want to get you on that baby train, and I want to get you feeling good with your life. And I want you to live as long as you can, and I want that to be a good, productive life. So I did a quick little Google search on what's better, surgery or medicine? And I got the answer. I mean, we talk about it all the time because I'm a member of Obesity Medicine Association. I'm a member of ASMBS, that's our Metabolic Society. I'm a member of IFSO, that's the International Bariatric Society. And by far, all the research shows that you will have the best outcome with surgery when you compare it to medication. Now, what are the pros and cons of each? And you know what I'm going to do? I'm going to pause this just super quick because I'm about to walk onto a busy street, and all you're going to hear or see are cars going by. All right, so what is the research showing? The research shows that by far, in terms of upfront weight loss and long-term weight loss, so what has the greatest impact on your BMI is it's going to be surgery. When you look at what medications can do for you, generally patients can lose about 10 to maybe 15% of their total body weight with medication. So that means if you are on, let's say Ozempic or semaglutide or Wegovy, by the way, those are all the same thing, probably could lose 10 to 15 pounds if you're 100 pounds overweight. Sometimes up to 20. And now, do I have patients that are on these medications and they lose a lot more? Yes, they can. And do I have patients that take Lomera or Phentermine and they lose more weight? Yes, they absolutely can. But then I compare these to my patients that undergo a duodenal switch or have a gastric bypass, and the outcomes are 2 to 3 times of that. So, like, I did a sleeve on a gentleman. Now, granted, he was 500 pounds overweight, and but within the first 90 days, I mean, I'm fibbing. Within the first 6 weeks, he was down 90 pounds. I can tell you, there's no medication that's on the market that can do that for someone. And so, the next question that I will get from patients is, if I do a medication, is it going to be a lifetime? Do I have to be on it? How long does it have to be? Because the question is, whenever they start looking at surgery, they start to think, well, that's just permanent. But let's ask ourselves the real question. If you're coming to see me and you're having issues with your weight, you probably really need to have a solution that is going to be lasting. You know why? Because you've already done everything else. You've done the cabbage diet. You've done that Cleveland Clinic diet or the heart diet or grapefruit 45. Nobody's going to remember that unless you're like my age or older. You've already done all these gimmicky diets. You've already lost and regained several hundred pounds, 20 pounds here, 30 pounds there, 10 pounds, 5 pounds, fluctuating back and forth. So again, if you're coming to see me and I'm a weight loss specialist, I want to give you the goods, So what does the research also show? If you are on a GLP-1 agonist, so if you're on Ozempic, Wegovy, semaglutide, Mounjaro, those do have a very good effect on your diabetes. And they absolutely can help to lower your hemoglobin A1C. That was initially why they were designed. However, we also know that surgery, in particular, the duodenal switch and the gastric bypass, and this was like back in 2015, there was a landmark, oh God, that's just a leaf. There was a landmark study that came out that showed that bypass and duodenal switch being the best, will put your diabetes into remission if you've been treated for 8 years or less. Remission, that means it goes away. That means you had surgery, nothing else to do. Now, you still need to make sure that you're getting your follow-up from your primary care doctor or your endocrinologist. But I mean, can you imagine not having to take your insulin, or not having to use your insulin pump, or not having to take metformin that can make your stomach upset? This is huge, huge. And the reality is that there is no medication on the market that can do that. There's no medication on the market that will make you or will allow you to lose the amount of weight that you need to lose and also help you keep that off. So I know that I'll have patients that will ask me, well, what would my maintenance dose on this medication be? Do I need to decrease it? To which I ask them, I'm like, well, right now you're taking blood pressure medicine and your blood pressure is being maintained on your, let's say, 40 milligrams. Your doctor wouldn't suggest, well, your blood pressure's maintained now, let's go ahead and decrease that dose. Because you know what will happen? Blood pressure probably won't be maintained. You got to stay at that dose. So your maintenance dose, whatever the chronic disease is, your maintenance dose is where things are maintained at status quo. So if that means that you are on the highest dose of any one of the weight loss medicines, whether it's phentermine, whether it's Contrave, whether it's Qsymia, whether it is Wegovy, whether you're taking Ozempic, Wegovy, Mounjaro, name it, fill in the blank. Whatever that dose is, that is maintaining your weight. Guess what? That is your maintenance dose. The downside with medications like phentermine or Qsymia, which has phentermine in it, is that you just can't be on those medications long term. I know whenever Qsymia was going through its trials, patients were on it for about 2 years, and so that's generally, I would not want to go over a patient being on a medication that long. And I think when you begin to have these discussions with patients, you really need to see what are your long-term goals and what are your short-term goals. If you have to have surgery and your surgery is in 6 weeks, you have to have it for your back, but you cannot have it unless you lose maybe 10 pounds and your insurance is flipping in January and it is November when you're coming to see me, then I want to be very realistic with my patient. And I'm going to tell them it all depends on your BMI, so where your weight is, and what your doctor that referred me, what they're trying to do. So this is what you need to know. If you are trying to lose 10 pounds and you need to do it in 6 weeks, regardless of what your weight is, then clearly medication is really going to be your only option, because it's probably going to take about 6 weeks to get you on the bus for surgery. Now, if you're paying cash for a surgery, then guess what? You'll lose 20 pounds in 30 days. I can guarantee you that. Sometimes 25, sometimes even 30 pounds. But most people don't have the extra cash stacked in their back pocket to get a surgery. If you're paying cash, and especially you don't want to do that if you have Bariatric coverage with your insurance. So what does this also mean? Let's say you have to lose a lot of weight in a short period of time for whatever that reason is. You need to be realistic that, again, if you're coming to see me, it's because you've had difficulty doing this in the past. There is no easy fix. There is no magic bullet. And even if I give you medication that suppresses your appetite, and remember, The only thing that these medications do is suppress your appetite. You still have to make sure you're putting in the work. You have to make sure that you're increasing your protein uptake. You have to make sure that you're logging your food all the time, every day. If you put it in your mouth, you put it on the log. I really like MyFitnessPal and I really like Bariatric. You have to make sure that you're doing some form of exercise to increase that calorie deficit. Now, if you're going to have a hip surgery, guess what? Probably can't go out and walk. Have a difficult time doing that. But that doesn't mean that you can't get some little elastic bands and do some arm exercises. Every little bit helps. And so whenever I've had patients call me frustrated that they haven't lost any weight, my next answer or question to them is always, besides the medication, what else have you been doing to make sure that you're a success? Because when you're only doing medical weight loss, that just means that you have to put in a lot of work. You have to put in a lot of work, whether it's surgery or whether it's medical weight loss. It's a different type of work, but it's still work. And so if you find that you're stalling out or you haven't lost any weight, you need to go back to the basics. Increase your protein, log your calories, remain in a calorie deficit, drink your water. So I hope that this has kind of helped you somewhat. If you have a tremendous amount of weight to lose and you want to have a longer, healthier life, I mean, all the research tells you that surgery is the way to go. I think the good news is that the surgeries that we do now, they're safe. Generally, they're just an overnight stay. Some of them you can actually have done the same day, depending on the facility. So don't let fear, and whatever that fear may be, don't let that hold you back from being the healthiest that you can be in this year. So hope that this helped.